Good afternoon, everyone. Thank you for joining us today for a Cancer Cabinet community conversation hosted by the Veterans Health Administration. My name is Dr. Stephen Lieberman, and I have the privilege to serve as the Deputy Undersecretary for Health for the Veterans Health Administration. At VA, we are fully aware of the health challenges facing rural communities and are taking every opportunity to share how we're expanding access to best-in-class cancer care for veterans enrolled in our equal access healthcare system. Of the 9 million veterans receiving healthcare benefits, 1/3 of them live in rural areas. Approximately 60% of rural communities do not have an oncologist. To address this gap, programs like VA's National Tele-Oncology, or NTO, allow veterans to receive world-class oncology care and services regardless of where they live. Working shoulder to shoulder with various partners, NTO delivers screenings as well as diagnostics and treatment for medical oncology, including rehabilitation and palliative care, all to improve access and outcome for veterans. A key component of our efforts has been to increase access to screening and early detection services because we understand that early screening means better outcomes. We're proud to share that VA is expanding access to lung and colorectal cancer screening for veterans. We're bringing our lung cancer screening program to every VA medical facility, which will help save the lives of the nearly 5,000 veterans who die from lung cancer every year. And VA will expand screening for colorectal cancer, the second leading cause of cancer death in America, by providing more than 1 million veterans nationwide with convenient, safe, and effective tests that can be completed in the comfort of their homes. VA also established the Clinical Cancer Genetics Service, or CCGS, to provide veterans with world-class cancer genetic counseling that is readily accessible regardless of where they live. We'll hear from a veteran about their experience with how CCGS uses genetic testing to improve the detection, diagnosis, and treatment a little later. VA has expanded Close to Me Cancer Care, a visionary initiative designed to bridge the gap between veterans and accessible health care. Close to Me brings anti-cancer therapy services closer to veterans' homes, ensuring that veterans have easy access to the care they need, where they need it. Close to Me will bring new cancer diagnosis, treatment, and surveillance services to an additional 9,000 veterans by the end of October 2025. This work is a part of fulfilling President Biden's Unity Agenda, Cancer Moonshot, and VA's focused and consistent efforts to provide world-class care for over 1 million veterans on the cancer care continuum, from screening to survivorship. You'll next hear from VA oncologists and frontline staff who live and breathe the work of providing best-in-class cancer care to veterans every day. They'll share how VA's expansion of cancer care aims to save even more lives and significantly improve the long-term health outcomes in veterans for generations to come. You'll also hear from a U.S. Air Force veteran who will share her firsthand cancer story and the impact that genetic testing and expanded access to such services can have, not just on her care, but the impact it had on her family as well.
I joined the Air Force because I wanted a little bit of adventure in my life. I had just graduated from high school, a little small town in Louisiana called Opelousas. In 2016, I found out that I had cancer. I had breast cancer. It was a very aggressive form of cancer. It's called triple negative. And so, yeah, it was a whirlwind.
Cancer in general is caused by genetic changes in a cell. If we knew you were at risk for those things, we would look more carefully. We would look pointedly. CCGS is Clinical Cancer Genetic Service. We are available anywhere.
My treatment plan here has been just absolutely phenomenal. I don't actively have breast cancer at this time. It's completely gone. But I have a genetic defect. It's called the BARD1 defect. And so because I found out that I had this, I actually have MRIs twice a year and I have a mammogram once a year. Looking back on it now, I'm thankful that I did the genetic testing, because now instead of living in fear, I can be proactive so that that we can always be on the alert for new cancer growth.
If we find a patient who shares a gene change that puts them at higher risk for cancers, we need to be able to set up appropriate surveillance, risk-reducing surgeries, and cascade testing, making sure that all of their involved family members get the benefit of counseling and testing as well.
BARD1 is it's hereditary. I have a son and a daughter, and because I know this now, they're aware. They've made their doctors aware, so they will start early screening in hopes that they'll never have to experience cancer.
We are there to make sure that every veteran anywhere who either has cancer or is at highest risk for cancer is able to get quality, timely genetic counseling and testing.
If I hadn't had the VA, I wouldn't have continued seeking health care, and I would have just been living in fear. It's been a complete blessing.
Without further delay, I would like to introduce our first panelist, Ms. Margaret Lundquist, a nurse practitioner based out of our Salt Lake City VA Medical Center, who works providing support to our veterans through our comprehensive genetics service. Ms. Lundquist is here to walk us through her clinical perspective of genetic testing and the impact she's seen it have on the care our veterans receive when facing a cancer diagnosis. Thank you for joining us today, Ms. Lundquist. The CCGS program seems increasingly valuable, especially considering the rising awareness of hereditary cancers. Could you elaborate on the types of genetic counseling and testing offered?
Absolutely. We focus on three main areas. We have an appointment for pre-test counseling. This involves assessing the veteran's personal and family history to decide if genetic testing is indicated, and if so, what type of testing we should order. At this appointment, we'll discuss the family history of cancer in detail. At the follow-up appointment for post-test counselings, we discuss the results and what this means for the veteran's cancer risk, their health care plan, and their family members' potential risk. And then finally, we have an annual follow-up clinic for veterans who are found to have a gene with a mutation in it, where we ensure the veteran is getting the most current management recommendations.
Thank you, Ms. Lundquist. Can you give specific examples of how a family history might indicate a need for testing?
Sure. Let's say a veteran has a maternal grandfather with pancreatic cancer, a mother with breast cancer, and a sister with ovarian cancer. Another example is a family history of multiple family members on the same side of the family with colon cancer, endometrial cancer, or a combination of these cancers. Both of these patterns raise a red flag for potential hereditary factors.
Interesting. How does CCGS handle situations where veterans have cancer themselves? And can you also share an example?
Sure. In some cases, when a veteran has a diagnosis of certain cancers, that diagnosis alone would meet criteria for genetic testing. A few examples are high risk or metastatic prostate cancer, pancreatic cancer, breast cancer, including male breast cancer, ovarian cancer, and colon cancer diagnosed in a young age. In other cases, it's the combination of the veteran's diagnosis with cancer and a certain pattern of cancers in the family, which would indicate a need for genetic testing.
Thank you, Ms. Lundquist. Are there any other scenarios where a veteran might benefit from a referral to CCGS? And how often is a mutation found on genetic testing?
Sure, if a veteran has a close family member with a known mutation in a cancer gene, genetic testing for that gene change is important to help understand the veteran's risk. If a mutation is found in a cancer gene, this can have significant impacts on the veteran's healthcare plan and help us understand what other family members might be at risk for inheriting the same mutation. To answer your second question, a mutation is found in about 5 to 10% of cancer cases.
We're discussing expanding access to care with this panel, and one of the advantages of CCGS is that it uses telehealth appointments. Can you elaborate on how this benefits veterans and what a follow-up might look like?
Telehealth appointments make genetic counseling and testing much more accessible for veterans, especially those living in rural areas. The veterans won't need to travel to their local VA or miss work for appointments. We conduct appointments via VA Video Connect or the telephone, and we offer 2 testing options. One is a saliva kit that would be mailed to the veteran's home, and the other is to have a blood draw at their local VA. In terms of the follow-up, we'll have a follow-up appointment to discuss the results in detail, including the implications for the veteran's healthcare plan and how this impacts their family. We will provide a summary letter to the veteran and communicate the results to their local VA providers. For those veterans with a positive genetic testing result, we will follow them annually to ensure they are receiving the most current management recommendations, and will also provide letters to share with family members so that they can pursue testing if they're interested in it.
Final question, Ms. Lundquist. How can veterans access the CCGS program?
Sure, your VA primary care doctor or oncologist can provide a referral, or veterans can contact us directly through our VA email, which is cancergenetics@va.gov. We're happy to answer any questions you may have.
Thank you. With that,
Thank
I'd like
you.
to introduce our next 2 panelists, Dr. Vita Passero and Andrea Stone. Dr. Passero, the Chief Medical Officer of VA's National Tele-Oncology, or NTO, is at the forefront of ensuring all VA patients have access to specialized hematology, oncology care, and treatment. NTO allows veterans to receive world-class oncology care and services regardless of where they live. Dr. Passero, thank you for joining us today. I'd love to talk about the ways that tele-oncology is meeting the needs of veterans. How will veterans benefit from choosing tele-oncology?
Thanks, Dr. Lieberman. Well, we know that veterans do benefit from choosing tele-oncology, but I'll get into that in a few minutes. What we saw in the VA, the veterans, the caregivers, the staff, is this question kept coming up a few years ago. Could we bring cancer treatment and care closer to where the veterans live? And what we know in the VA is that we are not limited between state lines. We can provide the highest standard of care across the nation, whether it's tele-oncology regionally or nationally. And so the goal is to bring comprehensive services to the veterans, no matter where they live. And we know this prior to National Tele-Oncology, that VA medical center teams have worked on the use of tele-oncology to do, for example, telechemotherapy. So the VAs in Pittsburgh, Omaha, Ann Arbor, Palo Alto, for example, but not limited to those VAs, those teams worked to make sure that veterans could get their care closer to home. So for example, in VISN 21, where Palo Alto VA serves as a hub for their clinical resource hub. They've ensured that patients through teleoncology could get access to the highest standard of care for prostate cancer advanced therapies, no matter where they live in VISN 21. And in regarding VA Pittsburgh, when patients ask, hey, could I get my treatment closer to home? What we did in VA Pittsburgh is we created a clinic with the Altoona, Pennsylvania VA Medical Center to create an infusion clinic where patients could get their chemotherapy treatment and continuity of care and palliative care at their clinic without having to lose their oncologist at VA Pittsburgh. We used telehealth, teleoncology, so we could continue the care with those veterans and their caregivers, and they could continue to receive treatment, surveillance, palliative care, and survivorship care with the team at VA Pittsburgh and with the nurses and pharmacy at the Altoona VA. And 2.5 years later, we opened a clinic similarly in the Erie VA Medical Center to be able to provide care for those veterans living in those rural areas. And so what we have seen is that VA medical centers have really come together in line with what veterans have requested and have wanted to be able to get that care closer to home. And so we have seen 2 studies where we have seen that veterans do like their care. And so the Ann Arbor VA team published a study where 80% of veterans agreed that teleoncology visits were as satisfying as in-person visits. Another study out of from our colleagues in Northern California VAs found that over 70% of veterans would recommend virtual cancer care to a family member.
Thank you, Dr. Passero. Would you also share with the audience how VA's National Teleoncology supports all aspects of the cancer care continuum within VA, from screening to survivorship?
It's one of the benefits of being one of the largest integrated healthcare systems is that we are able to provide comprehensive holistic care. When we talk about comprehensive holistic care, we are integrated from the beginning through surveillance and through survivorship, and that includes screening. For National Teleoncology, we have cared for over 17,000 veterans with our services through National Teleoncology. At any given time, 44 to 50% of those veterans are from rural areas. So they may be areas where there may be limited to no oncology services. National Teleoncology gets in there to be able to make sure that veterans do receive their cancer care. So we are bringing comprehensive services to the veteran through a virtual hub based out of the Durham VA in North Carolina through that VA healthcare system. And we are staffed with various physicians, advanced practice providers, clinical pharmacy practitioners, care coordination nurses, telehealth staff who are virtually based throughout the nation to be able to get the care to the veteran. The care that we're giving is along a cancer care continuum. We provide second opinion through what we call asynchronous electronic consults. We also do second opinion through a synchronous video visit, but we also provide continuity of care from the discussion of diagnosis through treatment, through addressing potential side effects of treatment, through surveillance, through survivorship, so that veteran gets continuity of care with our National Teleoncology team. We also have services where, let's say an oncologist needs a consensus opinion with other physicians, other nurses, clinical pharmacists, surgeons, radiologists, pathologists. We do have disease-specific virtual tumor boards where should a consensus decision be requested, we make sure we have regular virtual tumor boards to be able to provide that consensus team decision-making for that type of care. So we are working with teleradiology and telepathology within the VA, services that are provided by the VA and supported widely to be able to get that type of care for veterans and also for their caregivers. In addition, as you heard earlier, we have genetic counseling and testing, and over 2,500 veterans have benefited from that service. And you hear about Close to Me, where we took it one step further to see how can we get some, but not all, chemotherapy closer to where veterans live using our primary care clinics, our community-based outpatient care clinics.
Dr. Passero, can you also tell us about cancer research at VA?
Yes, one of the initiatives that is here and that we are rapidly expanding is our clinical cancer research services, spearheaded by one of our oncology leaders in the VA. And what she has done is really provide a platform so that patients and caregivers can have a supportive information network with clinical cancer research nurses to understand clinical trials and how to get from point A to point B should they be interested in a clinical trial, and to understand what clinical trials are available to them. In addition, the ability to have decentralized clinical trials at VA medical centers is a related initiative to make sure that patients have more increased VA options to be able to access clinical trials within the VA, no matter where that VA medical center is located.
Thank you again, Dr. Passero. We are honored to be joined as well by Andrea Stone. As a registered nurse and associate chief nurse for specialty care at the Minneapolis VA healthcare system, where she has served for nearly 34 years, Andrea Stone is one of the champions of VA's efforts to expand access to cancer care closer to where veterans live. Her experience in nursing and VA has been critical to making the new Close to Me Cancer Care program a success. Ms. Stone, thank you for bringing your perspective to your discussion today. Can you explain for our viewers, how did Close to Me Cancer Care originate and how it currently is filling a gap in cancer care services?
Certainly, thank you. The Minneapolis VA healthcare system is the most rural in the country. We serve 13 community-based clinics across Minnesota and western Wisconsin. These community-based clinics are at least 40 minutes away from our main medical center, and some as much as 4 hours away. We saw a need to serve veterans closer to their home and decrease their travel burden. We started with some simple activities. We did access ports for blood draws and provided some injectable medications for our cancer patients. This allowed us to then expand virtual opportunities for veterans and their providers. We continued to grow and add additional medications. We added IV medications, including chemotherapy. Our successes and the gratitude of the veterans are what motivated us to continue to push forward. Close to Me in Minneapolis now serves all of our community-based clinics, but we also added the 3 community-based clinics in the St. Cloud healthcare system. We routinely provide many IV infusions and assessments so our patients don't need to travel. We also have started having oncology-trained specialty providers traveling to serve and expand the care delivery for our rural veterans. Examples on how we're filling the gaps. Well, recently we had a healthcare system close in western Wisconsin, and many of our patients had lost their healthcare locally, and they were scrambling to establish new care. We very quickly, even before the close of the facility, started sending oncology providers to the Chippewa, Wisconsin community-based clinic. The VA filled the gap in care and provided both provider and infusion care closer to their home.
Thank you, Ms. Stone. As a frontline employee, can you share about how VA's efforts to expand access positively impacts the veterans you care for every day?
Sure. The changes have significantly impacted veterans' lives. It's giving them time. Instead of potentially spending their entire day traveling to the VA for an infusion, they now drive locally. They get to park close. They get to leave after their 30-minute or hour infusion and spend time doing what they value. As I shared previously, we have so many examples of patients who choose the VA and we can provide their care closer to home. But an example of just one. We had a veteran who was positively impacted by this expanded access. He was a decorated Army veteran. He participated in 3 conflicts. He was also a public servant in a small town in Duluth. It was very important for him to get his care from the VA, and while continuing to serve his community. He had a reoccurrence of his multiple myeloma and needed twice-weekly chemotherapy treatments. Prior to Close to Me, that would have meant 2 full days traveling to Minneapolis, almost 3 hours each way. Understandably, that's a considerable burden on his time. With the Close to Me care, he was able to come to Minneapolis 1 day a week, had his provider visit, his blood draw, his treatment, and we were able to bring a second day of treatment to him at the Twin Ports Superior Community-Based Clinic, and he was able to continue to serve his duties and his role as a public servant.
As we have a few minutes to spare, I'd like to follow up with our panelists and ask, what advice would you give veterans facing a cancer diagnosis? Or for the providers here today, a veteran living rurally who may be at risk for cancer?
The advice I would give would be for veterans to contact their primary care providers, whether within the VA or if they're being seen in the community, to let their primary care know, hey, I hear that the VA is providing these services. Could I be seen within the VA? And from there, that we will contact that veteran once we are connected with them to be able to ensure that they get the services they're requesting.
Thank you for those insights. To those on the panel, what else would you want veterans to know about cancer care at VA?
Well, I think from the genetic testing perspective, we really have an innovative program here to deliver genetic testing to veterans across the country, no matter where you live, no matter what time zone you're in. And we really want to make veterans aware of that because it can impact not only cancer treatment, but their screening and their family members. So it can change the treatment recommendation. So we really encourage you, as Dr. Passero said, to reach out to your primary care or your oncologist and connect with us so that we can see if this might benefit you.
With that, today's discussion and panel has come to a close. I'd like to thank all of our amazing panelists today for your inspiring stories, as well as your dedication to expanding access to VA's best-in-class cancer care. On behalf of VA, we want to encourage veterans to reach out to their VA providers about how VA can support them wherever they may be in their cancer care journey. A reminder that the Veterans Health Library is available 24/7 for veterans, family members, and caregivers to receive comprehensive, consistent, veteran-focused health information no matter where you receive care. To learn more, visit veteranshealthlibrary.va.gov. If you would like more information about cancer care at VA, visit cancer.va.gov. And for more background on the Cancer Moonshot, visit whitehouse.gov/cancer moonshot. Thank you all for joining today's event.